Welcome to Medical Marijuana and Wellness. Today, we're going to talk about an important topic, terpenes, and we're going to also give you a guide to which terpenes you should use for your particular condition. Joining me today is Amy Green, an RN with MMTC. Amy, thank you for joining me.
Always wonderful to be here, Mark. Thank you.
You do a lot of work with patients, and terpenes are one of the keys to really understanding the right products to use to address their conditions. Is that correct?
That is correct. Yeah, it's part of building a treatment plan for a patient is kind of isolating which terpenes are going to be most beneficial for those patients. And a lot of times that figuring out that terpene that's perfect for you does take some trial and error.
Sure. So let's take a look at some suggestions. First of all, what are the main components of cannabis?
Yeah, so cannabis, as we know, is made up of three main components. You have the cannabinoids. That's going to be your THC, your CBD, and your other minor cannabinoids. Then you have terpenes. Now, terpenes are organic hydrocarbons that give cannabis its smell and its taste and have a lot of beneficial side effects. For example, linalool is also found in the lavender flower and it aids in relaxation. Another part of the cannabis plant is the flavonoids. So flavonoids are another naturally occurring compound that also contribute to the color, taste, and smell of the cannabis plant. And they're also providing some really helpful benefits like being an antioxidant, anti-inflammatory, and possibly even disease prevention.
Yeah, and when you put those all together, you get what they call the entourage effect.
Yeah, so the entourage effect is how all of these different parts of the cannabis plant work together to create a kind of a very broad effect that's very helpful to patients.
Right, and it's something that's found uniquely found in cannabis. Now, terpenes are interesting. They are really fat-loving compounds. Why don't you tell me a little bit about what a terpene is?
Yeah, so again, terpenes, naturally occurring hydrocarbons, they are fat-loving. So if you were to consume a fat-loving product or such as chocolate, peanut butter, something like that, that's a great vehicle for the terpenes and the cannabinoids. They're naturally found in all sorts of flowers, foods, fruits, vegetables, and these are very familiar smells when you start to realize, for example, pine has pinene in it, and mint has eucalyptol in it, and that's really what's giving those pungent smells to those particular products.
And a lot of reasons why the terpenes exist is because the plant uses it to really, when it's growing, to really defend itself off from attacks from other creatures, fungus, insects, and pests, large grazing animals. So the terpenes are there to really protect the plant. That's why they're there. But then once the plant is harvested, it turns out that those terpenes can be used for medicinal purposes, which is great. Why don't you give me a couple of the common ones like linalool?
Yeah, so we already talked about it a little bit. It is in lavender. It's that very pungent floral smell, and it's really great at assisting with relaxation. Additionally, you have limonene and myrcene. So limonene is that fresh citrus smell, and then myrcene can be more of a spicy smell, but combined, they are what you find in spearmint. And both of these products or both of these terpenes have anti-inflammatory properties and antiseptic properties. Another one is camphene and pinene, which are found in ginger, and they're also really great for pain relief.
So also we have some other characteristics of terpenes. Why don't you tell me about those, Amy?
Yes. So again, terpenes are organic hydrocarbons, meaning that they're organically, naturally occurring compounds. Now, a terpene is the original form of that product when it's found on a plant. A terpenoid is a terpene that has undergone oxidation, meaning it's been cured and or dried. Now, in the actual cannabis plant, though, terpenes are actually found in the greatest concentration in the trichomes, which are those little, almost shiny tips of the glands at the end of the cannabis plant.
Sure. And that's where you get a lot of the smell and the flavor from as well. Now, terpenes themselves are found in cannabis, but also terpenes are also found in a lot of other botanical products. In fact, there's over 20,000 different terpenes found in other products. So it's not unique to cannabis to have terpenes. They're very common that's out there, but really extracting them is pretty difficult. And that's where having a professional dispensary at your disposal to be able to provide the terpenes is really, really important. Growing your own and being able to make your own product you may not be able to get the full effects of a lot of the terpenes that are out there. So let's chat a little bit about the most common terpenes that are there. These are kind of the 8 most common terpenes. Your thoughts on this?
Yeah, so these are the ones when you see a certificate of analysis or COA from a dispensary, these are the ones that you'll see most often in large quantities in the products. There are minor terpenes as well that you just won't see as often, but are still naturally occurring in the plant.
Now, let's go back and take a look a little bit. How do you know what's in your product? There's something called the COA, Certificate of Analysis.
Yeah, and so the certificate of analysis, this one, for example, has more limonene than any other product or any other terpene. And then farnesene, which is a minor terpene, is actually the second most abundant terpene in this certificate of analysis. So this product actually has a little bit of a different terpene profile than you would see with any other product. And that's really the unique thing about a cannabis product is it's going to be a little bit different every time. But when you can start to identify those common terpenes that you're seeing over and over again that are appearing in large quantities and you're having benefits from that product, that's really a terpene that you want to put in the back of your mind as, hey, this product is helpful to me and it has a lot of this terpene.
Right. And in this particular case, the terpene profile is about 7.25%. Now that's pretty high. Most products are usually between 3 and 4%.
Correct. Yeah. So this product certificate of analysis is for specifically a rosin coin, which is a form of a concentrate. And so the terpene percentage will be higher than you would find in, say, for example, flour. Flour, the normal terpene range you'll find is anywhere from 1 to 2% to maybe up to 3 to 4% at the high end.
So let's take a look at, so the big question is, for my particular condition, which terpene should I use? So let's kind of dive down and talk about that. Now, we built a chart, and this chart, it really talks about the different symptoms and each of the terpenes, how they actually, if they address that particular symptom is now, if they address that symptom. Now, this is a very busy chart. So rather than just diving down into this, and let's talk about the different conditions that are out there. So Amy, for arthritis, give me the best terpenes to use. And also it's important to point out, arthritis has some symptoms like joint pain, redness, minor swelling, whether it's osteo or there's OA or RA. Each of these conditions really dictate which of the terpenes you use.
Certainly. So what you're doing when you think about arthritis is you're thinking about the actual symptoms that the patient is suffering. For example, that joint pain. So you'd want to be looking for a pain relieving property. Now we can see from this chart, every single terpene is going to provide pain relieving properties. But as far as, say, somebody that has rheumatoid arthritis, they might need something that is more of a muscle relaxant. So they might lean towards products that have more myrcene, which has been shown to be an effective muscle relaxant.
Sure. That's important. And I think also anti-inflammatory is important. Most of the products, in fact, all the products address inflammation. But again, it goes down to what is your particular condition and what do you want to particular address? It might be mood, it might be pain relief, it might be a muscle relaxant. And again, here's a little bit of a guide for which of the terpenes to use. There's not really a blanket for arthritis. It's more which ones work for you for your particular condition. Very, very much personalized. That's there. These are some of the main ones that you really want to take a look at.
Certainly. So when we are looking at beneficial terpenes for arthritis, we start to identify some that we start seeing over and over again. So that's the pinene, that's the myrcene, that's the carotene. All of these products are going to be providing an analgesic effect or a pain relieving effect, but also they're going to be a powerful anti-inflammatory.
I think that's really, really important. So, basically, just a quick guide, the pinenes, linalols, myrcenes, and caryophyllines are going to be the ones for arthritis. But again, going back to what we showed you before, if you have other conditions, you may want to take a look at, or other symptoms, you may want to look at broadening that terpene profile. Let's talk a little bit about stress and anxiety. This is a big one for a lot of people.
Absolutely. So, stress and anxiety is a very broad topic, but it can include so many symptoms that it's really going to be personalized how the patient chooses to actually tackle that. So, some patients may have headaches, high blood pressure, chest pain, heart palpitations, skin rashes, or loss of sleep. And what we want to do is look at that individual condition. So, say, loss of sleep, and we would be looking for something that is more sedating to help with that loss of sleep for this particular patient. Now, there are other sides of stress and anxiety. So you might also have nervousness, worry, fear, or unexpected biological reactions that can occur to any situation or stressor. So it's really going to be very personalized to the person to identify the symptoms that they want to treat, and then to
Yeah.
look at the specific terpenes that are going to target that specific symptom.
Right. And it's really important to point out a number of people that have stress and anxiety it can come from PTS, it can come from, like you say, sleep, chronic pain, and depression. This is something that's related to this. Now, let's talk about cancer for a moment, because cancer is a big one. It's not just a matter of treating the cancer, but also in many cases, people are getting chemotherapy, radiation. It's a treating the basically treating the treatments is the best way of putting it.
Yeah, so a lot of patients that are undergoing any sort of cancer treatment, they're probably going to have side effects from the treatment. Cannabis is very effective at managing some of those side effects. For example, a lot of times when a patient is going through chemotherapy, they might have a significant loss of appetite. We know that cannabis can be a very helpful appetite stimulator. And so that
Mhm.
might be what the patient needs from the product right then.
Right.
Uh, Other times it might be, they just need something to help with pain and anxiety while they're actually doing their treatment. Cannabis
Sure.
can also be really helpful in addressing those symptoms as well.
So, Amy, for cancer, there's a number of terpenes that work. Why don't you kind of highlight those for us and why we'd use different terpenes?
Absolutely. So when we're thinking about cancer, again, we're looking at symptom relief. So we might be thinking about a pain relieving terpene, maybe something that can help augment different types of chemotherapy, which would be caroflene, something that might help reduce the proliferation of cancer cells, which can actually be several different terpenes, and then potential tumor reduction properties, and which is several different terpenes again. So we've got your limonene, caroflene, and geraniol. So when we're thinking about cancer, again, we're really looking at symptom management and matching those terpenes to that symptom and what is going to help with moderating that symptom that the patient's having.
Yeah. And listen, cannabis works very well. The terpenes work very well to address cancer. It just, again, it depends on your particular condition. It's a very personalized approach to this. So it's important to pay attention to what you're trying to accomplish. Once you do that, then you can identify the terpenes, and it's very easy to be able to then match it to a product. This makes life a little bit easier for cancer patients, and not only just for cancer, but also their chemo and the radiation that goes along with it. Let's talk a little bit about pain management. This is a big one. Why don't you give us some idea of what we're looking for here? Because there's a lot of different terpenes that can help us.
Certainly. So when we're thinking about pain management, the main thing that we're thinking about is people just want a reduction in their level of pain. So we're talking about an analgesic, something that is relieving pain. We can see from the list here that pretty much every single terpene is going to help with pain. Additionally, when we're thinking about pain management, we know that oftentimes, not always, but oftentimes, pain can be caused by inflammation throughout the body. And so when
Mhm.
we're addressing that inflammation, we can conceivably help reduce the amount of pain that the patient is having because of that inflammation. And as we can see from the chart, pretty much every terpene is going to help with inflammation. So
Right. And it's important to point out that addressing pain directly is something that cannabis does. But also, like in my particular case, I have an artificial left knee, which gets inflamed, and when it's inflamed, that causes pain. So if I can reduce the inflammation, I can reduce the pain. And in many cases, products that are higher in CBD and products with these particular terpenes can help with that particular condition. So again, it depends on what you're trying to accomplish. But in this particular case, cannabis works pretty much to help most of the pain conditions. But again, you got to decide whether you want to look at for anti-inflammatory or pain relieving properties that are out there. But it's a very important and the key product to use for pain. Let's talk about fibromyalgia, because fibromyalgia comes in a lot of different, has a lot of different, let's just say, conditions or characteristics.
Absolutely. So fibromyalgia is one of those conditions that is usually a cluster of symptoms that the patient is experiencing. So a patient might have some or all of these different side effects and symptoms as a result of the fibromyalgia. So when they are targeting a symptom that they want to relieve, it might be a whole range of symptoms that they might be experiencing. For example, obviously pain, they're going to want to look for anything that's an analgesic. Extreme sensitivity, that might be something to do with inflammation. So an anti-inflammatory might help with that. Same thing with the stiffness and muscle spasms and anti-inflammatory. Poor sleep quality, we'd want to look at addressing getting to sleep and staying to sleep.
Mhm.
And there are certain terpenes that help with that. So pretty much, again, we're looking for what specific symptoms the person is trying to address, and then finding the terpene that best addresses that specific symptom.
Yeah, and it might be important to point out that, especially in fibromyalgia, your stress level, changes in the weather, and also your physical activity can have a bearing on the pain and the conditions or the different symptoms that you have from fibromyalgia. Here's some of the terpenes that can be used, and I think this is kind of really important because, again, it depends on what symptom you're trying to address.
Certainly. So when we're thinking about a muscle relaxant, we're really going to be looking for that myrcene. It's a really,
Mhm.
really great muscle relaxant. But then when we think anti-inflammatory, that's pretty much any terpene that you can imagine.
Mhm.
So we might be looking at a wide range of terpenes, but then looking more narrowly at what myrcene can do for us, because we know that besides relieving pain, it's also going to help with inflammation, but it's also going to help with the muscle relaxation, and it's going to be a little sedating. So
Right.
it's kind of addressing several different things all at the same time.
Yeah, and also if you're looking at something to help you sleep, this is where linalool and myrcene work together in this particular case. So again, it is effective for fibromyalgia. Falling asleep and staying asleep. This is a webinar that we did, and you can look at it in our YouTube library with Dr. Greg Holt. And what we looked at is the different conditions or that we were trying to address and the different terpenes that'll work. And these pretty much across the board help with both the pain relieving capabilities that help you fall asleep. Because if you get rid of your pain, it'll also help you fall asleep. But you're also looking for something that's very sedative. And these particular set of terpenes, the linalols, the myrcenes, the terpenolines, the germanols, and the boronol, all are very effective to help you not only get to sleep, but also fall asleep. These will actually help you get to that place where you're going to actually fall asleep. And then, of course, the route of administration, how long the duration and onset really has a lot to do with, with effectively addressing it. We'll talk about routes of administration in just a moment. Again, we're going through all the different symptoms that are out there, but really the question becomes, how do I get the most out of these terpenes? I've identified the terpenes or the terpene profile I want to look at. How do I get the most out of it? And really, one of the things to pay attention to is the temperature, especially if you're vaping. This is kind of key because you can actually burn off a lot of the terpenes if your vape pen is really too hot.
Certainly. And when we're talking about temperature, this might be the difference between the low, medium, and high setting on most vape pen batteries. But this is going to be what is temperature. So how do I put this? Temperature is going to be one of the biggest things that affects how much of those terpenes you're actually receiving. The
Sure.
higher temperatures, those terpenes are going to burn off, and you're not necessarily going to get the benefit from them. Versus at low temperatures, you're a lot more likely to get the actual medical benefits from those terpenes.
Right. And in your vape pen, there's vape pens that have no temperature setting, no, the button turns it on and off. And if it does that, your temperature setting is going to be 295 degrees, just to let you know. If you can have a vape pen that lets you set the temperature, you'll have a low, medium, and high. That'll be like a green, blue, red, or you'll the first click, the second click, the third click, and this gets you to the low, medium, and high setting that you find that's out there. That's how you set that on the pen. I recommend a vape pen that has a temperature setting. Your thoughts on that, Amy?
I absolutely agree. I usually refer to it as a variable voltage battery. I am a huge fan of getting ones that have a very wide range of available voltages. That's not only going to allow you to control the temperature of it, but it's going to control or better, it's going to make it easier for you to actually take an inhalation from the product with less negative side effects. So less irritation to your throat and your lungs, less coughing, and generally just a better experience because you're getting more of the terpenes with that lower temperature and maybe not necessarily a huge hit of the cannabinoids like THC, but you're definitely getting more of the terpenes at that lower temperature.
Sure. And it's critical when you deal with talking with your dispensary, ask them if you can set the temperature. The difference between one where you don't set the temperature and you do, the cost is minimal between them, but the benefits that you get by being able to set the temperature is really dramatic, and it's really key that's out there. And again, your dispensary will help you figure that out. Let's talk a little bit about the routes of administration. This is really key because what's really key is really the onset and the duration time, because this is important, especially if you want to, for example, fall asleep and stay asleep all night, or if you just want to address pain right now to be able to get rid of it. Tell me a little bit about these.
Yeah, certainly. So when we're considering what products would be appropriate for us or for a new patient, I always ask them, what are you comfortable with? So if a patient has never been a smoker, never vaped in their life, I'm generally never going to recommend inhalation products to them because it would be something they'd be less comfortable using. First, we're going to look at what the patient is comfortable with, and then we're going to look at what they are specifically trying to treat. So say the patient has breakthrough pain and they need something really quick to help them get their pain back under control. Those really quick acting products are going to be the inhalation products, also known as a vape. It's going to be smokable flower, and it's going to be concentrates. Those are the absolute fastest forms of any cannabis product. However, all of those forms involve having to inhale a product. So it might be something that a patient might be uncomfortable with. In that case, we're going to go to products that have a longer onset time, but they generally last a lot longer.
Yeah,
So
and I
those,
should point out that some topicals work rather quickly as well. In other words, if you have something that's like a bruise, a bump, or something like that, or you have something that's on the skin, this will really help. The topicals really help, especially if you get a transdermal. That'll work fairly quickly within, let's say, 5 minutes.
Yep, certainly. When we are looking at products that are going to last a long time and help the patient receive longer benefits than, say, a vape or a flower, that's where we want to be looking at the sublingual drops, also called a tincture. We might also be looking at edibles or even the transdermal patch. We're looking for something that is going to take a while to take effect, but then the effects last a long time.
Sure.
So those are all very effective products for that.
And I think it's important to point out, for example, sublingual drops will work usually between 15 to 20 minutes and last 4 to 6 hours. But edibles and capsules could take up to 2 hours to work. And this is where, when you get into the gummies, the brownies, the cookies, be cool. It may take 2 hours to work. I mean, about the time that you think that it's not working and you take another one is about the time it starts working. So in this particular case, great products to use, but you need to have patience to be able to use them. You'll know when they start working. You'll feel the relief coming from that particular product. Just be careful, because you can actually take too much of this if you try to just take it, again, within that 2 hour window. Your thoughts, Amy?
Certainly, I think you're totally right there. It's be cool. Give it a chance to work. And we really always recommend waiting for that high end. So if it says it might take 15 minutes to 2 hours, you would want to wait at least 2 hours before you took another dose.
Right. And I know it takes a little bit of patience, but edibles are something that you don't eat like Skittles. That'll cause it's just you'll become uncomfortable if you do that, and that's what we want to try to avoid. So, Amy, we talked a lot about terpenes. We talked a lot about what terpenes people can use, and also how to use it, because I think that's what the routes of administration and the temperature is all about. I think if people want to look at more education on this particular subject, we have a YouTube channel, YouTube Marijuana Aware, where we have literally over 100 different videos out there that you can take a look at on not only different conditions, how it affects but also on different ways of using the product. And again, things like terpenes, and we explain medical cannabis. So please pay attention to, or please go to that particular resource if you're looking for more information. And then also don't forget to like and subscribe, very important. Also, if you're looking at getting a card here in the state of Florida, we recommend medical marijuana treatment clinics. Your particular final thoughts, Amy?
Absolutely. So as always, I recommend that a patient use a treatment journal in the beginning to help establish a routine and a plan that works well for them. Always start at a low dose and gradually increase it to a spot where you're comfortable. And then just like you said, just be cool with edibles. Just take your time with them.
Yeah.
Uh,
Anyway, thank you very much for joining us. I hope this helps you understand which terpenes can be used for your particular condition. This is really the key to being able to get the relief and the comfort that you're looking for using medical cannabis. Thank you very much for joining us.